Now, I know you've been hearing about cervical cancer, human papilloma virus, HPV. So in this video, I'm going to be throwing more light on cervical cancer, what you need to know about cervical cancer. So stay with me. Hi guys, welcome to my channel. So today I'm going to be talking about cervical cancer. Now January is Cervical Cancer Awareness Month, and in this month we like to inform and enlighten our women about the dangers of cervical cancer and the importance of routine screening and vaccination. But before I go further, kindly click on the like, share, comment and subscribe button. What is cervical cancer? Before I explain what cervical cancer is, I'm going to be telling you what the cervix is and where the cervix is located, because I know some of you don't know what it is. Now, the cervix is a muscular organ. In other words, the cervix has the ability to what contract and dilate. Now, the cervix can expand, and in situations where we see the cervix expanding is during childbirthing. So I'm going to be doing a little demonstration. Pardon me. I have with me a pen and a mouse. Now the pen is going to represent a vagina and the mouse is going to represent a uterus. Now a cervix is located at the lower part of the uterus. Let's take this to be our cervix. Now from the outward inward, the cervix connects the vagina to the uterus. I hope you got that. Now what is cervical cancer? Simply put, cervical cancer is cancer of the cells in the cervix. Naturally, a female cervix is lined up with millions of cells. Now, cervical cancer develops when the cells lining the cervix starts to grow out of proportion or grow out of control. These cells go on to become precancerous cells, and if left undetected, can become cancerous cells. What causes cervical cancer? 99% of cervical cancer cases have been linked to the human papilloma virus infection. I know you've heard of HPV. Many people undermine the severity of human papilloma virus. Now, get this, almost all sexually active people at one point in their life get infected with the human papilloma virus. But there are two sets of people. There's the first set. This set of people, their immune system will be able to clear out the human papilloma virus from their body, while the second set, persistent infection with high risk human papilloma virus, would cause their body to develop abnormal cells, which would now lead to cervical cancer. Now, who is at risk of developing cervical cancer? As long as you are a woman with a cervix, you are at risk of developing what cervical cancer. Yes, there are risk factors that predisposes you to developing cervical cancer. Let's look at those. One, having sexual intercourse at an early age can predispose you towards cervical cancer. Secondly, is having multiple sexual partners. Amaka, you see this habit of jumping from Femi to Tom to Peter to Paul, it is not helping you because it exposes you to what the human papilloma virus, and which predisposes you to cervical cancer. Another risk factor includes popping long-term use of oral contraceptive, popping birth control pills for a long period of time. Another risk factor is smoking. Another risk factor is having multiple children. Another risk factor is family history. If you have a mother, sister, aunt, grandmother who has at one point in their life had cervical cancer, this puts you at a greater risk of developing cervical cancer. Another risk factor is also having an underlying STI, an underlying sexually transmitted infection. Example is chlamydia, gonorrhea, and HIV. This predisposes you to HPV infection. What are the symptoms of cervical cancer? The early stages can be hard to detect, but there are some common signs and symptoms that you can look out for, and they include watery or bloody vaginal discharge, which could be heavy and could produce an offensive odor, vaginal bleeding after sexual intercourse, vaginal bleeding after menopause, vaginal bleeding in between periods, and heavier and longer than normal menstrual periods. How can you reduce your risk of developing cervical cancer? The answer is simple: by screening and by vaccination. Girls under the ages of 9 to 14 are advised to take the human papilloma virus vaccine. This protects them from the human papilloma virus infection. And girls above the ages of 20 are advised to routinely get screened for human papilloma virus and also get vaccinated. Now, it is advisable that even after getting vaccinated, you also carry out regular screening tests. Another way you can help reduce your risk is by protecting yourself, practicing safe sex. Another way you can help yourself would be to stop smoking or not to smoke at all. There are two major screening tests for cervical cancer. Now you have the human papilloma test. Now this test is a DNA based test. This test detects the DNA of human papilloma virus in the cells in your cervix. Now this test detects the presence of high risk human papilloma virus types, including type 16 and type 18, which have been linked to being the major causes of cervical cancer. We also have the pap smear test. Now pap smear test detects abnormal cells in your cervix. Another cervical cancer screening test is the liquid-based cytology (LBC) test. This test is more sensitive and more specific than the pap smear. It detects not only high-risk human papilloma virus but also low-grade cervical changes. It is more accurate and less invasive than the conventional pap smear test. Now, ladies, it is of utmost importance that all females with a cervix get screened for cervical cancer. Parents, I urge you, if you have the girl child, get her vaccinated with HPV vaccine. This is 2024. Get informed, get screened, and get vaccinated today. That'll be all for today, guys. I hope you were able to learn something. Now, do not forget to like, share, comment, and subscribe. Until next time, guys. Bye.